50% in time counseling, because they're going to ding you on that piece. You also need to make sure and think about in terms of medically necessary. My example I keep going back to is with the cold. You're going to be hard pressed to prove to an insurance company that you needed to counsel someone for 30 minutes because they had a cold. Because remember, that's low risk. They're probably going to get well whether or not they came to the doctor's office. So you can get away with some of that counseling, but make sure there's a reason that they're there and you're talking to them. There may very well be a reason. They have allergies. They're not taking good care of themselves. It's the 5th cold they've had this year. That's going to justify counseling, but you're going to also chart that. Due to the recurrence of their colds, we spent some time discussing hygiene, washing hands, fruits and vegetables, etc., so they can prevent future colds. That becomes medically necessary. So just think about the insurance company is looking for the medical necessity of your conversation. Here's some examples of when you're going to probably need to use time. Patient returns to discuss findings of a colonoscopy, and you spend the whole time talking about that colonoscopy, and you do it 20 minutes, 20 minutes of the 25-minute visit was in counseling. You're going to code it based on time. Patient comes in for follow-up on his diabetes, which is well controlled. He's doing well, but he's had 20 pounds of weight gain. So you spend most of the visit talking about food habits, goals, planned follow-up, what you're going to do. 20 minutes of a 30-minute visit was in counseling. That's going to be a 99214. So those are absolutely legitimate ways of using time. Counseling versus psychotherapy in CPT. Most of us are not covered for the psychotherapy CPT codes. They're not reversed to NDs. That may be different insurance company to insurance company, but when we're talking about counseling, we're talking about counseling in the context of medical issues. If you're doing more psychotherapy, you really need to pay attention to their benefits, because chances are that's not covered as an ND if they actually know that you're doing more psychotherapy. I build some of that counseling, psychological, emotional counseling into my visits, but in my chart note, I put it in the context of self-care, new coping mechanisms, stress management behavior. So again, it's about semantics. If you're doing straight psychotherapy, that may cross over into a cash service because we're not psychotherapists. At least in Washington, that's my understanding, that they're not typically going to pay. Most primary care docs, whether you're a medical doctor or a naturopathic doctor, we're not psychotherapists, so those codes for psychotherapy are typically not reimbursed. If I do counseling around emotional issues, which is part and parcel with what a lot of us do as NDs, I look at my semantics in my charting. So I put it in terms of self-care, stress management techniques, behavioral technique or behavioral modifications around how they manage, family relationships. Whatever you need to do to make it put it into a more medical context is my recommendation on the psychotherapy piece. Otherwise, it might be a cash service. Audit, practice, and prevention, really it's about just taking care. Don't undercode yourself, but do some self-audits every once in a while with the audit tool I gave you, so that you can make sure you're not getting lazy. We all get a little lazy. We do an audit twice a year at my office. We pick a couple of random chart notes out of different doctors' charts, and we compare them to the audit tool to make sure we're all covering our bases.